This program is intended to be general in nature and should not be used as a substitute for advice from a qualified health provider.
The coronavirus pandemic has changed the way we live, posing unprecedented health concerns and forcing businesses and schools to close. But armed with the right information, we can make a difference in the fight to stop this epidemic. Join us for a special Health Matters, a chance for you to have your questions answered live by Spokane's top public health physician and community leaders. Health Matters, Coronavirus, Ask the Experts. Right now on Health Matters.
Health Matters is made possible with the support of WSU Health Sciences Spokane, WSU College of Medicine, and by Providence Health Care.
With every twist and shout and every mended heart, we see you. You who trusts us to take care. Providence, health for all, care for you.
So tonight, I am issuing a stay-home order to fight this virus. This is Washington's Stay Home, Stay Healthy order. This includes a ban on all gatherings and closures of many businesses, unless those businesses are essential to the healthy functioning of our community or are able to let employees work remotely from home. It is still safe to go outside using social distancing of 6 feet, but really only for essential purposes. The grocery stores, doctors' offices, and other essential businesses will remain open. This also does not prohibit people from merely going outside to enjoy a walk on a sunny spring day.
Well, welcome. That was the governor of the state of Washington, Jay Inslee, just about an hour ago, announcing new, stricter rules for the state. Good evening. I'm Teresa Lukens, and welcome to this special edition of Health Matters. I've done nearly 100 of these programs, and at no time has the title meant more. Health matters. It matters for each of us, our families, and our communities. The coronavirus, COVID-19, is highly contagious and can be deadly, and we're learning more about it each day. Our purpose tonight is not to scare you, it is to give you perspective. Joining us to answer your questions by phone, text, email, and on our Facebook live stream are the community leaders that have been working tirelessly to protect us and keep us safe. Dr. Bob Lutz is the Regional Health Officer for Spokane Regional Health District. The Mayor of the City of Spokane, Nadine Woodward. Spokane County Sheriff Ozzie Knezovich, and Dr. Mike Marshall, Chief Physician Executive for Providence, Washington, and Montana. And I want to thank all of you for being here tonight. And thank you for the work that you've been doing in the last few weeks. It cannot be easy. I know it's put a strain on your own health, if anything, and your families. Let's start with some opening remarks. Dr. Lutz, the game sort of changed this afternoon with the governor's announcement.
It certainly did, Teresa. The last couple of weeks, we've really asked extraordinary measures of individuals. And again, I think it reflects this as an extraordinary time that we find ourselves in. We've been talking about a lot of what we call non-pharmaceutical interventions, such as regular hand washing, cough etiquette, and social distancing. Unfortunately, what we've seen is that social distancing message really hasn't hit home for a lot of people. And as I said, an extraordinary measure requires an extraordinary intervention, and that's what the governor is asking of us right now. It's social distancing, it's not social isolation, and I think that's a take-home message for a lot of people to realize. We still need people to socialize, but not necessarily in person.
Mm-hmm. Do we need to change that term? Has it become a little bit too watered down, if you will?
The social distancing term? I think, again, people haven't taken it seriously. And I think that's really the unfortunate matter. When you look at how we can be successful at fighting an epidemic, or in this case a pandemic, it really requires us to separate ourselves from other people where we may become contagious. People haven't been listening to that message. They haven't taken this seriously. And I think this is sort of drawing a firm line in the sand. We have to take this illness seriously. We have to really provide ourselves the opportunity of not infecting others, because that, I think, is the biggest concern. We have people who are asymptomatic, mildly symptomatic, and yet we know that they're infecting others. They're infecting older people who are at risk for serious complications.
Mayor Woodward, a game changer not just for the state, but for individual cities.
It definitely is, and we all support what the governor announced today, stay home, stay healthy. I think most of us knew it was coming, so I don't think it's a huge surprise. I would just say that, we have a plan to keep us inland strong. That is evolving every single day as we get new information, and the situation changes sometimes by the hour. But you cannot tell people enough that the single most important thing that they can do is really the easiest, and that is the social distancing. And it is the proper cough and sneezing etiquette, washing your hands regularly. And if you feel sick, stay home. And we've taken, in the last several weeks, all the measures that we can in City Hall to tell people to telecommute from home. If you feel sick, stay home. We've reduced our work staff incredibly, and we're doing everything that we can. We closed City Hall on Friday. I mean, we all knew that this was going to be happening. So, it's just, this is the new normal. I don't even know if anybody will ever really get used to it, but this is where we are today. I have to say, after this weekend of wonderful weather, people felt so great to get outside, and I looked around my neighborhood and saw so many people walking on the street and walking their dogs and jogging and just being outside, and most of them were exercising social distancing, but I almost saw it as a recalibration of the way we live our life now. I see more families spending time together that they never spent before, and I see more people engaging with their neighbors, and I know we're going to get through this. The Inland Northwest will come together, we will work through this, we will get through this, and we will be an even better community when we're on the other side of this.
Is this going to mean more businesses are going to have to close?
Oh yeah.
Those non-essential businesses.
And I think we'll get more direction on what those non-essentials are. I think we have to be very careful. This is not just a health crisis, this is an economic crisis. So we have to look at this both ways. And I think people were a little weary of what was going to come down the road as far as which businesses would be forced to close. I'll just say I'm happy to see that restaurants will stay open for takeout only. I think it's really important to keep as many people in their jobs as possible, especially in the hospitality industry, where almost half of them are living paycheck to paycheck. And what do we do with people who don't have a job? So what happens? They don't have money for food, or they get behind on their rent. So it's a snowball effect. So we need to keep as many people working and keep people healthy.
And Sheriff Knezovich, the governor said in his address this would be enforced. What does that mean for your deputies and city police, state patrol, law enforcement?
Teresa, one of the things that we're going to do is be out there to remind people, if we see them in crowds, hey folks, social distancing, maintain that distance, and we're going to use an extreme amount of education and to explain why. I've been asked several times, is this really all that necessary? And the short answer is yes. Why? Well, we want to keep people safe, we want to keep people healthy, and people need to remember that even though you're not showing any symptoms, you can actually still have COVID-19, and you could pass that on to a loved one. So let's take that added precaution. Let's not pass it on to a loved one. And one of the biggest factors for me is everybody needs to kind of take a deep breath, calm down, and we need to return to our normal shopping habits. We need to allow the supply chain to refill, because there's a lot of mothers, young mothers, and elderly people that need the basic necessities, and they won't have them if we keep cleaning them off the shelves. So take a deep breath, stop the panic buying, and allow those shelves to restock for your friends, your family members, and your neighbors.
And taking this action, Dr. Marshall, would or should help hospitals?
Yes, so I think it's important to know that hospitals and clinics have been at work for the last month to prepare for this virus. I think they've done a tremendous amount of work to prepare for it. But again, I'd go back and echo the social distancing. It is the most powerful weapon we can use to combat this virus. So again, we can worry about healthcare systems, but I think the public really have the power in their hands to change this themselves.
Talk a little bit about specifically what Providence is doing, how doctors and staff are preparing.
So I'm responsible for the medical groups in the region, and one of the main things we've been doing is essentially trying to segment the clinics. So we've segmented urgent cares and clinics to prevent infectious patients from coming into our clinics and making sure that they don't infect other patients or infect the staff within the clinic. So that segmentation process has been quite complex, but essentially trying to keep patients and staff safe.
Is there a network in place for the regional hospitals, Providence, along with the multi-care hospitals, in working together to make sure that is a smooth process?
Yes, so we have our own healthcare systems, and then within the city of Spokane, we actually have healthcare systems cooperating. Again, Dr. Lutz will probably know more about that than I, but essentially cooperating together. And again, the one thing that's also quite remarkable is the collaboration that's occurred within healthcare systems, between healthcare systems, and also with healthcare systems in municipalities like Spokane.
Okay. Well, schools no doubt have been affected. Educators, parents are facing some very big challenges. Superintendent of Spokane Public Schools, Dr. Shelley Redinger, was not able to be with us tonight, but I did sit down with her earlier today.
As a parent myself of a 17-year-old, it is, especially for the little ones, it's really a challenging time. And for parents, just again, I'm always telling myself this as well, just staying patient and active listeners, because all of us, our minds are elsewhere, and children more than anybody notice when we're really not with them in the moment. So just active listening, that patience, staying calm, because this is really uncharted territory for all of us.
Mm-hmm. How are the educators, the staff, the support staff, teachers doing?
They've been amazing. As you know, this moved really, really quickly for us, and so we had that one last day of school, and staff just went over and beyond to have packets ready and items ready, and I just really appreciate our staff and all the hard work. And right now, as you know, we're doing food and childcare, and staff has really helped with that as well.
Do you anticipate being able to continue to do that as long as?
Well, what we're hearing from the governor and our local legislators is that the goal is for us to continue to provide food. This is really important, kind of a basic need, an essential need for many of our families. And so we are providing a breakfast as well as a lunch for students. Anybody 0 to age 18, you do not need to show proof that you're free and reduced lunch or anything like that. And so I do think that will probably need to continue, and we'll get advice and guidance from the governor on that. And then of course childcare for our first responders.
And how were you able to hand out laptop computers? Talk about that piece.
Well, we have cows, computers on wheels in most of our schools. And so all of those have about 25 laptops. And so we were able to take those apart, and now then we can check out the laptops to students. So we've already checked out about 3,500 laptops, and so the need is out there, and that gives students a way to connect onto assignments, onto Office 365, on Blackboard, so they continue their learning.
So we're actually very early on into this, but families are already feeling a little cooped up and looking for ideas. Do you have some?
Oh yes, there's quite a few things families can do together to reconnect. One of my favorites is whenever we had an extended holiday break, or my brother or I, if either of us were ill, my mother would make homemade Play-Doh. And so I want to share that recipe with everyone, so we're putting that on our website. And it's a great way to have children do something else, help make it, and really keep them active. Another is it's spring. So if you could get some seeds, or if you already have some seeds, you can pick some up at a grocery store and plant little seedlings in the windows and kind of plant your garden inside. And so just stay active. Even board games, as long as you do social distancing, it's a great way to pass some time at home.
And not all learning has to be from a book. Those are great learning experiences. Yes. Yeah, very good. Thank you. Dr. Shelley Redinger, and their website for Spokane Public Schools is a great resource. Be sure, if you're a parent or a grandparent that needs any kind of advice or needs to know any of the protocol, check out the website. Dr. Lutz, let's talk about testing, where we're at with that, what it means to flatten the curve, some of those terms that we're hearing a lot.
Sure. Well, first of all, with respect to testing, I think everybody is well aware, unfortunately, of the challenges we've had with getting testing. It's both a national issue and unfortunately been a local issue. Speaking to Dr. Marshall's comment earlier, the last 2 weeks have really shown a great collaboration between healthcare organizations. As many people are aware of, last week we started up a drive-through testing site down on the fairgrounds, which again represents that collaboration. Because of the restrictions, or if you will, the limiting factors in the past on testing, it's been very difficult for people to get tested, even if maybe they have the symptoms. We're trying to liberalize that somewhat. And again, this drive-through clinic really provides that. So whereas before we were saying you had to meet very strict criteria, now that's been liberalized somewhat. So again, what we're encouraging people to do is to either call their provider or call one of the nursing health hotlines, find out, does that person think you should go and be evaluated? And then again, you could go down to get evaluated. They will still assess you and determine whether or not testing is appropriate. And again, we've seen good responses from that. For example, over the weekend, we had more than 150 tests done. And when I tried to check in this afternoon, a lot more tests were being done. So again, I'm encouraged by that.
Mm-hmm. And what about flattening the curve? This new move to get more of us to stay home and social distance, the idea is to flatten the curve. Explain what that means. It's basically slowing down the progress, right?
Right. Ideally, you're both slowing down the progress as well as decreasing the peak. So again, as we've talked about, the importance of social distancing, the importance of trying to prevent others from getting infected. We know that these pandemics have what we call an acceleration phase. And what we're trying to do is to address the pandemic early in that point when you start getting a lot of cases. If I'm able to do that successfully, then we will see both fewer cases, and those cases that present will be spaced out over time. That therefore allows the healthcare system to be able to absorb that. That's not what's happened, unfortunately, in other situations. We're trying to prevent that from happening.
All right. We want to start taking your questions this evening, and we just want to remind you to try to keep them as short as possible and concise so that we can answer as many as possible. And first up is Darlene calling from Liberty Lake. Good evening, Darlene.
Hello. My question to you is, how many hospital beds right now in Seattle are occupied by the coronavirus?
Well, do we have any statistics out of Seattle, Dr. Marshall?
I don't have any statistics out of Seattle, no.
Mm-hmm. And are any currently in Spokane occupied?
Yes, we do. I don't know what the number is, but maybe Dr. Lutz, are you familiar with that?
I know we have a couple of cases. Again, off the top, I'm not sure the exact number, but we do have cases here that have both in individuals who are from Spokane as well as individuals who have been flown to Spokane because of our resources locally.
Mm-hmm. Okay, very good. Do we have another caller? Waiting for one to come in. Mayor Woodward, there's a lot of concern. We've already seen Bloomsday postponed until September. We have other big events coming up in the city of Spokane, including the Lilac Festival and parades associated with that, and then followed by Hoop Fest. Where are we at?
Good question. We know Bloomsday's been postponed. I love when they use the term postponed because that offers hope that we'll get to actually experience the event at some point when we're all through with this. I haven't heard anything from the Lilac Festival, and I'm sure Hoop Fest, which is a massive event, one of the biggest that we hold in Spokane. It takes a year to organize. I'm sure they're thinking very seriously about what their next step is. Mm-hmm. And especially with the governor's announcement today, I mean, I would assume that those would be postponed as well. Mm-hmm. No announcements yet from those organizations.
Mm-hmm. And Sheriff, we have seen you address panic buying, people cleaning off store shelves and try to minimize that and just do your regular shopping. Right. The supplies will be there. But we're also seeing an uptick in people buying guns and ammunition. Are you concerned about that?
I'm not concerned about it in that people are buying guns and ammunition. It's just another symptom of panic. And I prefer people just to kind of ratchet that down and focus on taking care of their families, maintaining your social distance. There's one thing about the economic piece, because as the mayor mentioned, we have a twofold issue. We have a healthcare problem and we have a economic issue that is rapidly developing. Last Monday, when we brought everybody together as a region, I made it very clear, and I'm going to ask the small business owners that may be listening tonight, please start tracking any of your losses now. As I stated last week, Spokane's recovery started last week. The reason we want those numbers is because the more diligent they are in tracking their losses and their employees' losses means the more likelihood we will be able to gather and capture financial aid for both the employer and the employee. So if you're a small business out there listening right now, please be keeping accurate records as to what your losses, not just for yourself, but for your employees are, so we can have that and submit it for the recovery packages.
Okay. We have Eric calling here in Spokane. Hi, Eric. Thanks for waiting.
Okay. My question's for Dr. Lutz. About a year ago, I was given a vaccine to prevent pneumonia. It was a prophylactic measure recommended by my doctor. It occurred to me that if we have a vaccine for pneumonia, has anyone thought to correlate the outcomes of the COVID-19 cases to see if that vaccination can lessen the symptoms of the secondary infection of pneumonia? And if so, would there be any benefit into widespread inoculation for the pneumonia?
So Eric, yeah, the question that you're asking, when we look at the vaccine for pneumonia, that's specifically for bacterial pneumonia. And unfortunately, this is a virus, so the pneumonia or the respiratory distress that's caused by this virus is not going to be impacted by having a pneumonia shot. So, you know, right now, obviously, we've talked about the ideal situation where we develop a vaccine for this virus. It would be a virus-specific vaccine, but again, wouldn't have any crossover with the pneumovax.
All right, hopefully that answers the question. Thank you so much for your call this evening. We have our first email coming in from Carol, who says, I am concerned that my many dear colleagues at Sacred Heart and all over the nation are risking their health and that the health of their families as they care for infectious diseases, not just COVID-19, without adequate PPE. When will our staff have this equipment?
So I can maybe address that just from the sake of the clinics. Again, I've focused mainly on the clinics, and I think, as I mentioned before, probably about 3 weeks ago, we started the segmentation, essentially trying to make sure that we separated infectious patients from non-infectious patients. So we've developed what they call fever clinics. So 2 of our urgent cares specifically manage infectious patients, while 1 urgent care doesn't. And we make sure that these patients don't come into our offices. We ask that patients phone the office prior to coming in if they have any kind of respiratory symptoms. They get diverted to these so-called fever clinics. And we take special precautions for the staff in these fever clinics to make sure that they don't get infected. So all the standard protective equipment is used in these clinics. The disinfection process that is so important is used in these clinics. So the segmentation process has been quite complex to develop over a medical group of about 900 providers. And this has been the mainstay of our way of trying to keep patients safe, staff safe, and our providers.
Can you also talk about the differences between the medical masks? Sure. We're seeing a huge effort by some companies, even individuals, making masks. And then there are the other type of masks and how each are used.
Sure, so Dr. Lutz can add to this, but the 2 main methods of infection are contact and droplet spread. There's been a big focus on N95 masks, which really relate to aerosolization. So within clinics, there are some exceptions, but within clinics, the main concern is droplet spread and contact. So basically contact, making sure you wash your hands, you wear gloves, you be careful about contact with surfaces. And then with droplet spread, surgical masks are adequate to actually stop droplets. Once the virus is aerosolized in a variety of ways, then you need an N95 mask to to prevent you from catching that virus. So again, we've been very careful with this. We've spent hours discussing this, studying this, making sure that our staff is protected according to the infection of the virus. And maybe Dr. Lutz can add to that a little bit about the difference between N95 and surgical masks.
I think you spoke to it well. Obviously, the size of the pore for an N95 is much, much smaller than what it is for a surgical mask. So that's where, again, you would be using an N95. Just the one other question was specifically about homemade masks. And I think it's been a wonderful outpouring of support. And I've had, over the last week, 2 weeks, people making all types of masks. And this past weekend, I researched what type of mask, what type of homemade mask, is there an actual pattern and what materials. And the take home for me is that the masks that we use in healthcare, they've, again, been validated, they're standardized, and they have to actually have approval to be used. I think the homemade masks, great idea, and again, I think of great benefit. I would be hard-pressed to recommend to a healthcare worker that he or she would place on a homemade mask. That really, if we ever get to that point, which I hope we never do, then that means that a lot of the backups have really failed. Because again, that is sort of like the last ditch. Now that said, for people out in the community, if that's all you have, then that will provide some benefit, but I don't want people thinking that it's going to provide the benefit that a standard mask would be able to provide people.
Okay. We have Howard calling from Dayton. Hi, Howard.
Hi, how are you?
Very well, thank you.
I have a comment on washing the hands versus using gloves. I'm approaching 80 now. I'm in good shape. I ski at Bluewood all winter. However, washing the hands, if done improperly, I wondered if it's effective as using, it's called Venom Steel Nitrile gloves. I'm a retired rocket scientist from Kennedy Space Center, materials engineering, and I'm finding that this nitrile glove is resistant to about any chemical. I carry a small bottle of isopropyl alcohol with me wherever I go. I do not touch anything until I get home, but before I get home, I sanitize the glove with isopropyl and make sure I kill the germ. Then I wipe everything down, and then after that, I might. So
Howard, we're going to address the two, the hand washing and the hand sanitizer. But thank you very much for your call, Dr. Lutz.
He follows incredible sanitary procedures. Maybe he should be a surgeon. Thank you, Howard. Again, great. I'm really glad you're doing all those things. For a lot of people, they don't have access to those types of gloves, and so very simply, we've shown that good hand washing, and again, done properly, and that's the key. It's good hand washing, appropriate period of time, soap and water is key. The hand sanitizer has to be at least 65% isopropyl alcohol, and you have to use it liberally on your hands, and you have to rub your hands until the hands are dry. That's when it's most effective.
Which brings to mind, Mayor Woodward, there's been some incredible initiatives. One of them being that our own Fly Distillery is producing that hand sanitizer. In fact, my husband did the drive-through today and got his free sanitizer. That's been a great effort on their part.
It's funny, Don is a friend of mine, Don Poffenroth, who owns Dry Fly, and he's one of these guys who, as so many people in the community have expressed, they just want to do something. And, being idle isn't something that is a talent of Don's. And so he got a federal approval right away. I mean, he knows how to get things done and just wanted to do something. And so I stopped by the distillery last week to see what the project looked like. And they're already in the hands now, bottles. It was interesting, he couldn't even find any bottles from around here. So everything had to be shipped in, and it's a very nice product. It even has essential oil in it, and they're already in the hands of our first responders. And he has had requests throughout the region, counties calling in from outside of Spokane saying, I need 50 gallons of that ASAP, can you get it to me? And I mean, he said, I can't even produce as much of the demand that there is out there for it. But I love that innovation, the creativity, people who just want to do something. And I'd say, you know, it's hard to plug people in the right places. We have a lot of needs, but you know, just be a good neighbor. Call people. So many churches can't have service now, but call your congregation members. Find out if they're okay. We have kids that my mom is an elderly. She's 78 years old. She's self-isolating, and she had some church kids come and do her yard work because she can't get out. And I just see all of that, and I think it's just wonderful that people want to just do something.
Absolutely. Let's take another email. This one from Jessica. This is coming in actually on Facebook this evening. Will travel outside of the area be allowed if needed to comply with parenting plans? Do we know under this?
There are no travel restrictions.
Okay.
So if you need to travel out of the area, you can travel out of the area. So that is a common question, though. Are we going to be locking down the border between, you know, Idaho and Washington? No. We have a lot of people that actually work in Washington, live in Idaho, vice versa. So there are no travel restrictions planned at this time that I remotely know of.
Okay. We have a phone call from Patty calling from Spokane Valley. Hi, Patty.
Hello.
And your question?
Well, I'm 62 years old, and I have idiopathic pulmonary fibrosis and usual interstitial pneumonitis. So I'm being very careful, and I have an N95 respirator, and, you know, I self-isolate. Question is this. I have very long hair, and I've been putting it back into French braid because what if I walk down a grocery aisle, someone before me that I didn't see coughed, and that droplet's going to get in my hair? And then is it possible for that to happen and it hang in your hair and then contaminate you later?
Thank you, Patty. That's interesting. Dr. Lutz, we're hearing a lot about how long the virus can live on certain surfaces. Yeah. That's a new one on me, though, with the hair.
Yeah, I mean, I've heard, again, reports that it may live anywhere up to 3 days, depending on the surface. We do know that UV light is something that can kill the virus, and so that's one thing. With respect to hair, I've seen questions around pets. And what if somebody coughs on my pet or coughs on a pet and then rubs? There's no evidence that you can catch the virus from hair on a pet. I would therefore extrapolate and say that probably would be appropriate. It wouldn't be caught from rubbing your hair.
Okay. We have not talked about what to watch for. And again, that's sort of an evolving topic in of itself. We were hearing fever, dry cough, and the tightness in the chest. Now we're also adding to that the possibility of sore throat, runny nose. What do we know today?
What we know today is more than we knew yesterday, and maybe not as much as we're going to know tomorrow. Mm-hmm. It really is fascinating. You know, we say that at the international level, we've said 80% of these individuals are going to have anywhere from no symptoms to mild to moderate symptoms. Therefore, about 20% require hospitalization. The classic symptoms are just as you mentioned, Teresa. They are chest tightness, cough, and a fever. But as you mentioned, we're seeing sore throats, we're seeing diarrhea, we're seeing gastrointestinal symptoms, and then we're seeing no symptoms. And so it really, you know, there is no classic way that this virus is presenting other than what we're looking for. Many people have it. I believe truly based upon the numbers, many people have it. They just don't realize they have it.
So at what point do you become concerned enough to say, I think I need a test?
Certainly if you have the symptoms, you know, you have those classic symptoms, certainly I would call your provider, talk with your provider, talk to a nursing hotline and run it by them. I sort of equate this at some level with during flu season. As providers, we know when influenza is in the community, testing is not necessarily required. You have symptoms that are consistent with flu, you have flu. We call it influenza-like illness. Right now, we're labeling a lot of these situations COVID-like illness. So you have a constellation of symptoms that, gosh, it seems like COVID, it may or may not be, presume it is. And so for me, I'd rather err on the side of caution. And if people think they have symptoms, even mild symptoms, I would encourage them to give COVID-like illness a consideration and plan accordingly.
Okay. Marie calling from Sandpoint. Hi, Marie.
Hi. I was wondering whether a person who dies, if there's any concern for the family, and whether that dead person needs any consideration as far as passing on any virus or at all.
Okay. After passing, or to the family that was present with them? Is that what you're asking about, Marie?
Well, the person that's dead.
Okay.
The dead body.
All right. In handling that, any concerns?
No, I mean, there's no immediate concerns about, again, when a person dies, if the person dies from COVID-19, there's no additional risk to any family members, anybody around the individual. I do know, however, having talked with the medical examiners earlier, that there are actually guidelines now that if somebody is diagnosed and dies from COVID-19, again, the guidelines are that an autopsy, for example, would not be performed, but that's not going to affect any family members, and that's not going to, affect funerals or anything of sorts like that.
Okay. Mayor Woodward, we have about 30 firefighters who have self-quarantined because of exposure. Can you speak to that?
They are under 14-day quarantine after being exposed on the job, most of them. That is about 10% of our firefighting staff. But we are still able to respond accordingly to any emergency that comes up. That's the risk of our first responders. And the good thing is that they were identified quickly and put into quarantine very, very quickly. And that's something that not just the first responders, but our critical care health workers also are faced with. And as one of your listeners or watchers said, they put their life at risk. And when we have an infectious disease out there in our community, this is something that they have to face. And that's why we need those PPEs, those personal protection equipment. It's so critical that they have that. And maybe the sheriff can speak. We've got an order in now for 20,000 that we're hoping to get very, very soon because they have to be protected.
And PPE is one of the issues that worldwide. And we're working very diligently to get that personal protective equipment here, get them in the hands of the first responders and our medical professionals, so we can minimize their exposure to this particular disease. One thing, Teresa, there's a lot of misinformation out there. Please verify the sources that you're getting your information from. You can come to Spokane COVID response.org and get that information. You can listen to Dr. Lutz's updates. We try to do updates on a daily basis, but there's a lot of misinformation that, quite frankly, drives a lot of the panic. So, not everything you hear or see on Facebook is actually true.
Some of those, too, have to do with some kind of crazy remedies and cures, if you will, floating around. There is no cure for this.
No, I mean, certainly there are some investigations right now on different antiviral medications that have been used successfully or unsuccessfully with some viral illnesses, but there is no cure. And again, I think there's a great hope for a vaccine, but there are some vaccine trials right now that are very investigational, so we're not looking for a vaccine in the immediate future.
Okay. Linda from Spokane. Hi, Linda.
Hi. I have a question. One thing I want to say thank you for everyone. You guys are doing a great job, and we thank you from the bottom of our heart, our family. I'm on SSI, and I was wondering if there's any help for anyone on SSI. I have gave a lot of my food away to my family. I've bought medicine. When they allot money to families, is there any help for people who are on SSI? Because I have nothing now because I gave it all away.
Mayor Woodward, what do we know about at this point? We know that there's some federal help coming, possibly state help. How is that all going to play in?
And then there's possibly some local help because we're working on a local economic response package too. Let me just tell your caller that if you're out of food, all the food banks are well stocked. There is no need for anyone to be hungry and out of food. I just met with our food insecurity specialist who's working on this in the community right now, and between Second Harvest and Northwest Harvest, they are providing all of the food to the smaller food banks, and every single one of those food banks is stocked. If you don't know where to go to food, call your local community center because they will be able to tell you where to go. Also with the school district, we've had lots of questions, people wondering, are the kids who get the free and reduced breakfast and lunches, are the meals available for them? Almost 60% of Spokane public school students rely on that. And the school district has just added 3 more sites. There are now 24 pickup sites, so they're able to provide all of those meals. So there definitely is help in the community. If you need food, call your community center.
And that's essential. So you can still shop at a food bank just like you would shop at a grocery store.
And they're taking special measures with the food bank too. They are wrapping everything individually and packaging things so that there are fewer hands on the food that the recipients will be eating.
Very good information. Glenn in Spokane Valley. Hi, Glenn. Are you there?
Hi.
Hi.
Yeah.
And your question?
I'd like to find out. Yeah, I have a caregiver. I'm totally disabled. And I have a caregiver coming in from the north end to the valley every day. Are they going to be stopped on the freeway from driving in?
I don't think so, Sheriff.
Absolutely not. That's an essential function. It's a healthcare matter, so you have nothing to worry about on that. You will be able to see your healthcare provider. They're going to be able to come and assist you, so you have nothing to worry about it. Again, I'm going to emphasize this, Teresa. There is zero plans of stopping people from being able to go from point A to point B. What this order really truly is asking people, unless you really have to go out, stay home for your own safety and your own health. If you have to travel, it's an essential function. You're more than happy to go out. You can shop. You can go to the pharmacy. You can even go out and go for a run, go for a walk. Social distancing and proper healthcare processes as far as washing hands and everything are very vital, but there is no, and I'm going to repeat this, no plans to restrict movement.
Okay, very good. Dr. Marshall, some concern about, we have a lot of smaller communities directly outside of Spokane. None of them so far, thankfully, have been affected with maybe just a few cases, but how are we supporting those small communities?
So we have a Providence hospital in Colville, and again, lots of planning. I think they've spent a month planning the hospital and the clinics. And essentially, if there are any significant cases that need a higher level of care, they'll be transferred down to Spokane, to Sacred Heart or to Holy Family. So again, I can't speak for other communities, but certainly in that community, there's a tremendous amount of involvement from our healthcare system to make sure that it does well.
In the event that they would need to transport patients to Spokane, that's been discussed as well?
It has. But again, some of these patients may just require supportive treatment as opposed to intensive care or ventilation.
All right. We have a call from Walt in Spokane. Hi, Walt.
Hi.
And you have a question?
Yeah. I work for a facility in Spokane that deals with national products for defense. I won't mention the name of the corporation, but we have approximately 3,000 workers, and there is no direction to stay at home. We're all showing up out at work, and we've had 2 active cases that have showed up and have been removed from the plant. They didn't test positive, but they were part of the group that were under suspicion. So for companies like this, when are they going to draw the line and say, you know, we need to shut facilities that have 3,000 people down and start limiting this kind of arrangement?
All right. Thank you for your call. We know that the rules are stricter as of this evening, but do we know, for instance, how something like that will play out? Who's determining what's essential and what's not? Do we know?
We do, and it's the governor's office. It's state and federal. We're operating under state and federal guidelines. We will, at 10 o'clock tomorrow morning, be able to give you a little bit clearer picture on that. We're trying to still sort that out ourselves. If you're deemed to be an essential function, it really comes down to the employer. Law enforcement is fairly what you'd call essential. We can't just go home. So we've taken some very extreme measures to make sure that our staff are safe. We don't have roll calls, no congregations, as little as we can. If it's a function that you can work at home, like our detectives, some of them are doing that. Non-essential staff is working at home, and we're running, in fashions that we do our best to limit that contact. So that may be something that the caller's employer may want to start taking a look at. How do you increase that social distancing? Because that's what we've done. We've increased the social distancing. We've given strict protocols about hand washing, trying to provide them with hand sanitizers. Dry Fly gave a bunch of that to our first responders. We really appreciate that. So it's going to come down to that particular employer, if it is an essential function, to work out the best way that they can to limit that social distance, or increase it, I should say, and to increase the safety of their employees. But if it's an essential function, that's the only thing you really can do. But it's going to be very defined coming out over the next couple of days. And here's the other side of that, Teresa. If you think that your industry should be considered essential, you can apply for a review. So it's going to be a little bit of a process until we really work that out. But right now, non-essential functions are limited, and we will be able to give you more of an idea of what essential means come tomorrow, the next day.
All right, as soon as those get laid out. We have an email coming in from Beth, actually on Facebook. I don't want to get infected or infect others. Is there a way to do a computer visit? I know there's been some medicine going on.
Yes, a lot of telemedicine going on. So again, our first ask is to, if you have respiratory symptoms, to contact the clinic by phone or electronically. We have chatbots that will hopefully answer a lot of questions just electronically. But within the next few weeks, we are trying to convert most of our visits to electronic visits with video conferencing. So tremendous amount of effort. But again, going from zero to have all your visits electronic is quite tough. So I think we're going through a bit of a difficult learning process, but that's the goal. So, but we can get hold of patients on their electronic health record, we can speak with them on the phone, and eventually we will hopefully do most of these visits electronically with conferencing, video
What's
conferencing.
the best route to take to begin that process?
Well, again, I think it's a triage process. Again, trying to approach. Quite often you can answer the question with this chat bot. You can answer a lot of questions just electronic health record. You can actually pose questions on the record, which can be answered. You can call your provider's office, and then if you want to have an appointment, you can actually have appointments with video conferencing. Some patients have to come in. But again, we're trying to convert a lot of these visits to video conferencing.
And that can be found at the Providence website?
Yes. Essentially, we hope within the next few weeks, most of these visits will be electronic and video conferenced.
All right. We have another phone call from Cliff. Is that Cliff in Spokane?
Yes.
Hi, Cliff.
Hi. I'm 81 years old and feel like I may have a target on my back. The at-risk people are elderly and diabetic and high blood pressure, and I have all three. I was pre-diabetic. I take metformin. It's under control, and I have a dosage of 5 milligrams of lisprinosol that I had to ask my doctor to give me blood pressure medication, but it seems to be under control. But the definition of diabetes is a little confusing to me because there's two types of diabetes, and I have I don't have type 2 as what I've been told. So could I get that clarified, please?
Dr. Marshall.
So a little unsure of the question. So yes.
I think he's basically concerned about his diabetes and high blood pressure playing in at the age of 81.
So, I think with this particular virus, there are concerns about elderly patients. There are concerns with predisposing conditions, specifically hypertension, cardiovascular disease, respiratory diseases. So yes, I think there is concern. I think the goal is to try and see if you can self-distance and stay at home as much as possible. But I agree, this patient would have higher risk than most other patients.
Mm-hmm. Which also brings to mind, Dr. Lutz, the mental piece of this. It's wearing on us. It's becoming a burden. For me, it comes in waves. One minute I think, I'm fine, we've got this under control as long as we do what we need to do. And then I get a bit of panic. And I think a lot of people are in the same boat.
Yeah, I think there's definitely your physical health, your mental health, your spiritual health, your emotional health. And I think all of those elements have to be addressed. We're certainly focusing, obviously, to some degree on the physical, but we can't discount the health effects of the other. And that's where, again, I think we talk about social distancing, but that does not mean social isolation. Right. And so how do we come together? We talked about coming together as a community, but we also have to come together as human beings. We talk about compassion, we talk about caring. So how can you be caring at some level distancing? So I think about the last caller. He's high risk, and then high risk from a physical standpoint, but socially isolating puts him at risk for other concerns. And so again, how can we connect with each other? How can we stay connected, acknowledging that social distancing is important, but social isolation is not something we want to be doing? Okay.
Brian, thank you for waiting. Brian calling from Spokane. How are you?
Good.
Good. You have a question?
Yeah, well, it's kind of two questions. I've been in the healthcare industry in Spokane for 32 years. I've never seen these measures being taken for the flu in the past. Last year we lost 30,000 Americans according to the CDC, but nobody did any measures like we're doing now. And can we expect these type of measures to be done in the future?
Dr. Marshall.
So I've never seen these measures taken in my career, and I'm sure probably you haven't either. Again, the flu we lose between 30 to 50, is it 1,000 Americans each year. But again, there are concerns that this may be a much more serious virus. So I think that's the reason. The concern is the mortality and morbidity rate would be much higher, and that's why the response has been so dramatic. But I've never seen this in my lifetime.
No, and likewise. And if I can just put things into perspective with respect to flu, we talk about mortality rate. So how many people are going to die from influenza? And just some numbers I think really ring home for me in expressing the importance of this. So the last major pandemic of any similar sort was the Spanish flu in 1918. It's estimated that the mortality rate, how many people died, was 2.5%. Okay, right now we're saying the mortality rate of this infection is between 2 to 3%. The mortality rate of annual flu is about 0.1%. So that's an order of magnitude of great significance. So again, if you look at, sheer numbers of people, yes, but the actual mortality rate is so much greater. And so again, that's where for me is really important for people to realize, yes, these extraordinary measures are being taken because this is an extraordinary time.
All right, Karen in Deer Park. Thank you, Karen, for calling.
Thank you for taking my call. Say, I just became a grandma on Saturday, and my daughter got home. Thank you. He's beautiful. And my question is, can I visit with them without putting her at risk? I have been, I'm a teacher, and so obviously I haven't been working this past week, and the only time I've been out is going to the grocery store. You know, washing my hands, change my clothes, wash my clothes, and all that. What are my worries and concerns there?
Thank you, Karen. And this is a concern for a lot of families right now. Do I interact with my children who live a few miles away? Can I see the new baby? What do we know?
Yeah, it's a fine line. We certainly know that older individuals are more at risk for at least complications, but we also know that young people can get the illness. We also know that young people can have no symptoms and yet transmit the virus. And so for me, that's of great concern. Just over the weekend with the beautiful weather, I saw lots of young people playing pickup basketball or playing games, and it was like, no, please don't do this. But so I think with respect to family get-togethers, it's done within the framework of appropriate social distancing. And it sounds kind of harsh, but you've got an infant, you know, a newborn infant who is very at risk for any number of infections. And again, I think it's this fine balance. So I want you to be able to, you know, to enjoy your new grandchild, but also with a lot of caution.
Mayor Woodward, we talked a little about one of the initiatives going on. There's also a few helping out restaurants, one where other businesses are adopting restaurants as their own. It's really amazing to see that innovation. What would you like to see, and what are you asking the residents, the people of Spokane, to do here as things even get a little bit tougher for us?
I would echo a lot of what the sheriff has said, and that is just take that deep breath and don't get so worked up. Sometimes just disconnect yourself, from the news, because we're peppered constantly with every new COVID update, and it can be overwhelming. My mom is 78 years old. She self-isolates at home. She's not online. So what does she do? She watches TV all day, and then she just is afraid. And that's not the way to be. I would just say, you know, exercise, the single most thing that you can do, the social distancing, taking care of yourself, stay healthy, keep your family healthy. If you can, do support the businesses. The restaurants are staying open only for takeout for a reason, so that we can keep our economy propped up and keep as many people employed as possible. But still, go to the grocery store, but don't panic buy. The banks are still open. You can still go get gasoline. Stay at home with your family, spend time with your family, and just know we're going to get over this.
All right. And we're going to leave it at that. And I want to thank you all for being here tonight, and again for the work you're doing for our community. And you're going to find a list of the most reliable, we stress reliable, websites for information on the coronavirus at ksps.org. And that's going to do it for now. Please stay home, stay safe, stay healthy. I'm Teresa Lukens. Good night.
Health Matters is made possible with the support of WSU Health Sciences Spokane, WSU College of Medicine, and by Providence Health Care.
With every twist and shout and uphill battle, we see you. You who trusts us to take care. Providence, health for all, care for you.